Welcome to The Explainer. Today, we are diving deep into that sharp, really annoying pain right on the inside of your elbow. And you might be thinking this is just for athletes, but trust me, whether you swing a hammer or just a mouse all day, you're going to want to stick around for this. So let's just start with a feeling that, might be a little too familiar. It's that specific ache, right? The one that just flares up when you try to grip something, turn a doorknob, or maybe even just make a fist. If you're nodding along right now, well, you're in exactly the right place. Okay, so this pain actually has a pretty fancy medical name, medial epicondylitis, but pretty much everyone knows it as golfer's elbow. And all that really means is that the tendons connecting your forearm muscles to that bony little bump on the inside of your elbow, they've gotten overworked and damaged, and that's what leads to all the pain and weakness. And here's the absolute first thing you need to get straight. Despite the name, you do not have to have ever picked up a golf club in your life to get this. Nope. The name just comes from that specific repetitive motion of a golf swing that can really stress out those tendons. What's really fascinating here is just how wide the net is for causes. I mean, you see the obvious ones, right? The climber, the baseball pitcher, that makes sense. But look a little closer. It can also come from the repetitive strain of a desk job, and even lifestyle factors like smoking or obesity, which can mess with how well your body heals itself. And as you can see, there's a really clear peak age group here, 30 to 60. And that is not a coincidence. It's often that time in life where the cumulative effect of years and years of repetitive activity, whether it's at your job or in your sport, it finally starts to catch up with you. So, how do you actually know if this is what you have? Well, we can break it down into two different buckets. Over on the left, you've got the symptoms. That's what you feel day to day. Things like that specific pain, feeling weak when you grip something, maybe some stiffness in the morning. Then on the right, you have the signs. That's what a doctor is going to find during an exam, like tenderness in a very precise spot or pain when they ask you to flex your wrist against their hand. Okay, now I need you to pay really close attention to these red flags. If you experience any of these, especially that numbness or tingling in your fingers or an elbow that literally locks up, that's a huge signal that something more serious could be going on. It is time to stop searching online and actually see a professional. So, a doctor is typically going to follow a pretty clear path to figure this out. For most people, a simple physical exam is all it takes. But if they need to dig deeper, they might use an X-ray just to rule out other stuff like arthritis or maybe an ultrasound to get a direct look at the tendon itself. An MRI, that's usually saved for the most stubborn or severe cases. So what does the road to recovery actually look like? Well, it's a step-by-step journey. And here's the key. It always starts with the simplest, least invasive options first. The first, and honestly the most important step, is all about what you can do yourself. This is all about giving that tendon a break. That means resting the arm, maybe adjusting your desk setup, and using simple tools like braces or doing some gentle stretches. For most people, this right here is the step that makes the biggest difference. But if that at-home care just isn't cutting it, physiotherapy becomes the absolute crucial next step. And this isn't just about feeling better for a day or two. We're talking about a structured program with specific exercises that are designed to actually heal the tendon and strengthen all the muscles around it for a real long-term recovery. Now, people always ask about injections, and it makes sense, as this chart shows a corticosteroid shot can give you some serious short-term pain relief, which can feel like a magic bullet. But, and this is a big but, the research shows that physiotherapy delivers way better, more sustainable results in the long run, and you don't have to deal with the potential side effects of getting repeated injections. For those really stubborn cases that just don't want to get better, there are more advanced options. You've got platelet-rich plasma, or PRP, which uses your own blood to try and speed up healing. Then there's shockwave therapy, which uses sound waves to stimulate the tissue. Both of these are designed to basically kickstart your body's natural healing process when it's kind of stalled out. But this brings us to the tough question, right? What happens when months have gone by, you've done everything you were supposed to do, and nothing has worked? When is it finally time to start thinking about surgery? Let me be super clear about this. Surgery is very much a last resort. As you can see from this timeline, doctors typically only consider it after a long time. We're talking 6 to 12 months of dedicated conservative treatment has failed to give you enough relief. It is not a decision that anybody makes quickly. And it's so important to weigh the pros and cons here. I mean, while surgery can be really successful for the right person, it is a serious step. It absolutely comes with its own risks, like stiffness, sensitivity around the scar, and in some rare cases, even nerve irritation. And that recovery? Yeah, it's not a quick fix at all. After surgery, you are looking at a serious rehab period. Getting back to demanding activities like sports or heavy work can easily take 8 to 12 weeks, and honestly, often even longer than that. But let's end this on the most important takeaway from all of this. Here it is. The overwhelming majority of people who get golfer's elbow get better. With the right care, some rest, and especially good physiotherapy, most cases improve a ton without ever having to even think about surgery. So, we'll leave you with this question. Now that you know the causes, all that repetitive gripping, the poor ergonomics, take a second and look at your own daily routine. What's the one small change you could make starting today to protect your elbows for the future?